Today's topic, you said, is fear or apprehension of going to a chiropractic doctor?
Yeah, I just thought I'd handle all the black PR right up front and get it done, because I hear it all the time, and people have it kicking around in their mind and their subconscious. So,
And what do you hear? What's the most prevalent comment you hear why people don't come to you?
well, when they do come, they'll be apprehensive. They may be afraid that I'll hurt them. They think that it's going to take forever. I'm going to have to keep coming back. They hear that business all the time. I just handle it with a joke, you know. I mean, how many chiropractors does it take screwing a light bulb? Just one. But you got to keep coming back. You get a quarter of a turn every time. So.
That's great. That's good.
So we'll handle the first one. I'm afraid that I'll be hurt. Well, it is possible to be hurt, I guess. I mean, it happens, but I'll tell you, chiropractic is very safe these days, and this is why. It's because the educational bar has been raised so high that everyone has equivalent education. Medic, osteopath, chiropractor, optometrist, everybody. Everybody has to make the grade, because this is the information age now. And so you are accountable. If you're looking at the public and something comes through your door, you got to be able to figure it out and then send them where they need to be.
Well, and you know why, Alice? People are scared because I can think of a million times in my youth where I'd say, my back hurts, can you pack my bag for me? To some friend, who all of a sudden pushes down, and it hurts because they don't know what they're doing.
They're not a chiropractor.
Right.
And I've done that to people. I did that to a girl once. She had a fractured neck, and I was trying to whip her neck around. I almost killed her.
That's all right.
But I'm not a chiropractor.
Dr. Brown. And I suppose, too, it can make it a little difficult because you're coming to ease your body, but you come in with a lot of tension to begin with when you're nervous and apprehensive. So that's probably a lot of work to get them settled down before you can actually start a treatment.
Sure.
So what other apprehensions did they have?
It's going to take forever. Why do I have to keep coming back? This kind of idea. And the way we handle it in my clinic is twofold. One, if they have a problem that can be resolved by manual methods, i.e. chiropractic, spine, shoulder, elbow, knee, foot, whatever, then we have to take a look at those tissues and see what kind of state they're in. And based on that, it's going to necessitate how long it's going to take. If you're a kid that just, fell off the chicken coop, it's going to take one treatment, slam dunk, over with. If you're 80 years old and you're full of arthritis, it's going to take 3 months. It's going to take a long time, which makes sense. The longer you've had something, chronicity,
Sure.
the longer it takes to get somebody stable or at least functional.
Do you pretty much have that answer there on the spot after you look at them and kind of diagnose them?
After the exam and the thorough evaluation, then I mull it over and take a look at everything, all the findings, and it fits into protocol. For example, a typical shoulder case that I might get, a rotator cuff problem, that takes anywhere from 1 to 5 to 6 to 7 treatments. That's it. A spinal disorder, maybe with a hot disc, somebody that's really hurt themselves, that's going to take some time. That's going to take about 18 treatments over the course of 3 months. Yeah, that's to save that disc, right? To save them from, a surgery could be $100,000, so it's usually worth it.
How about you use these like machines? I don't know the technical name. Do those scare people too if they've never had the experience of being treated?
Sometimes. Are you going to electrocute me? Are you gonna, all this stuff. Are you going to cook
use
me?
those machines? Kind of relax. Your
Yeah.
Most
They're
people,
freaky the first time.
Well, just it's like a wand I had.
Well, they have, but mine was like these how you
electrical
dial up
things.
the
Sure.
electrical. And it's fun, but
physical therapy, those are great.
Yeah.
Most people love it.
But they're worried at first, aren't they?
Sometimes.
I don't want to be alone in this
there's
feeling.
a risk.
Okay.
There's a risk. There's a risk in everything. Of course.
But I've been to a chiropractor. I had an injury to a joint that was just badly swollen, and they did the initial. And this was fairly recently. I had never been before. They did the X-ray. Turns out that one of my legs is significantly shorter than the other, so it threw everything off.
Sure.
So there was a period of time where I was getting treated for the joint, but also to get my back sort of aligned because it's been off for so long.
Yeah.
But even knowing what I know and getting the relief and everything, there's still that sense of what if they push a certain way and my spinal cord is, I mean, how do you know when you're learning your trade? How do you know that you're pushing the right way or manipulating the right way?
That's a great question. Well, I'll answer it 2 ways. One, my malpractice insurance is cheaper than anybody's because chiropractors never get sued. It's very safe. That's the bottom line. Okay. Secondly, we are so highly scrutinized before we touch a person. They make us work on each other first, which is a very painful experience indeed. It took years. to overcome that. Well, but
All the mistakes
everything
you're
is-
the sufferer of, huh?
you know, where are you at, which level, when we're talking just about spine. What's wrong, how do you know, chart all these notes. And then we had a clinic doctor come over and make sure that that was correct, and then micromanage you and watch you to make sure it happened, you see. We had to build the case why it was necessary to treat someone, or why not, you see. And then there were national boards. I mean, we were scrutinized to the max before they ever turned us loose on public.
That's amazing. Now, I have friends that are chiropractors for animals. Isn't that cool?
Oh, I never heard of that.
Yeah, I just thought I'd throw that in. It has nothing to do with our
But-
topic, but I
Tell
thought
me
I'd share
this.
something.
Sometimes if I'm just thinking of a friend who had like a pain in his neck, pretty bad pain, and the chiropractor had to try a couple times, and then it got like really snapped into place. And that's what scares people, I think, that they're pushing through or pushing against something that's really resisting. What is the situation where that's occurring, and what's actually happening?
Well, a lot of times when people are in pain, especially the spinal nature, you have nerves that come out between those bones, right? And when the body is injured, it's going to go into spasm to protect it. It acts like a splint. Now, say my neck is injured, so it'll become very spastic, very tight. It'll be painful. So it'll stop me, the carrier of this neck, from injuring it further, you see.
That's interesting.
So body's pretty smart like that.
Yeah.
So therapeutically, you have to overcome that some way. Now, I myself will not overcome that in a human being because it's drastic and it's painful. We do measures to calm it down first, and then when the body's ready, we make the corrective adjustment or whatever is necessary.
Now, those machines I was talking about, those are part of that calming process
That's right.
sometimes, right?
Exactly. You can stop spasm fairly quickly, and it doesn't hurt.
How does that work?
Well, with electricity, we can put an electrical current through a muscle and cause that spasm to electrically fail. It's like electrical current goes through it, it just drops,
You can feel it, too.
and it's over with. It stops instantly. Now, the Russians figured that one out. In the 70s, they were doing heavy weightlifting competitions in the Olympics. I forgot what that's called, powerlifting, right? And they smoked everybody. And they thought, oh, you guys must be on drugs. No. One of their research scientists decided to put electrical impulses through their muscles while they were exercising and made them stronger.
Isn't that cool?
So they figured all that out. Yeah, it's pretty
I
cool.
remember reading that story, yeah.
The history of muscle stimulation.
So bottom line is you should not be fearful before you pick
No.
up that phone to call Dr. Jeff.
Piece of cake.
Okay.